Cardiovascular drugs. These are the main ones that control blood pressure and heart rate. ACE inhibitors, beta blockers, angiotensin agonists, and calcium channel blockers. And here's how to know the difference between them. Starting with the ACE inhibitors, you'll notice they all end in pril. Beta blockers all end in lol, angiotensins in artin, and calcium channel blockers are a little bit different. You got the pins, the mil, and the zem. Essentially, the ACE inhibitors do not affect heart rate, but they do affect blood pressure. They manage hypertension, blocks the conversion of angiotensin 1 to angiotensin 2, hence ACE inhibitor. The biggest side effect with the prils is angioedema. And of course, always take blood pressure prior and monitor signs for that angioedema. The beta blockers, all end in lol, they manage hypertension. The difference here is the lols can affect heart rate as well. They block the stimulation of beta-adrenergic receptors. So because the lols affect heart rate, you have to watch for bradycardia, which is that low heart rate. And of course, taking the pulse and the blood pressure prior to giving this one because it does affect both. Angiotensin agonists, the TANs, they typically only affect the blood pressure and used to manage hypertension if another one is not able to be used. They block receptors of angiotensin 2s, hence angiotensin agonists. And of course, take blood pressure prior to give. And the biggest side effect here is renal failure. Calcium channel blockers, pin, amil, zem. They also manage hypertension, however, they can affect the heart rate here. It inhibits the transport of calcium into the myocardial and muscle cells. Biggest thing here is that arrhythmias and Stevens-Johnson syndrome. And of course, taking the blood pressure and pulse prior to giving, because this one can affect heart rate. On exams, the biggest things I'm going to tell you. The prils in angioedema, the lols in checking pulse and blood pressure, how the TANs affect the kidneys, and how this here can cause Stevens-Johnson syndrome. I hope this all made sense to you.